Hello, everyone. I'm Melissa Pache, CEO of the Whistler Chamber of Commerce. Today is Thursday, December the 10th, 2020. I'd like to acknowledge that we are having this virtual meeting on the shared territories of the Squamish-Lillooet Nations. We honor their language, culture, land, and traditions. Today, we are honored to be speaking with Vancouver Coastal Health Medical Health Officer for the Sea to Sky, Dr. John Harding. Hello, John. I want to start by thanking you and all of the frontline workers and essential service workers for your dedication in keeping all of us safe in such extremely difficult times. So before I hand this off to Dr. John Harding, I wanted to let you know what the purpose was for this, this conversation we're having today. We want to better understand what we need to know as a business community to ensure we keep businesses open and the community safe during this winter season and beyond. We definitely need to understand the protocols businesses need to know when dealing with sick staff, whether it's COVID related or not. And certainly we also need, and really important, to ensure that we protect our frontline medical staff, frontline workers in essential services, and not place any additional unnecessary pressure on them in an already overwhelming time. I'm sure, John, you probably have lots to talk about today, and I really appreciate your time being here. So the floor is yours.
Sure, thank you. I appreciate it, Melissa. And thank you for the opportunity to, I'd like just to start by acknowledging that this has been a challenge, I think, for everyone. And so, you know, we're in new territory. These things don't seem to happen that often. So, you know, I really appreciate everyone's patience. And it's not lost on us as well, too, the impact this has on people in their daily lives.
Sure.
We all just want to get back to normal, that's for sure. So, you know, first of all, I'd like to give a bit of an update on where we are right now, especially for the Whistler area. I'm sure everyone follows the numbers fairly closely, but in general, the majority of the cases still tend to be down in the lower mainland. Mm-hmm. So that's mainly Vancouver and Surrey, Fraser Health area. We do have ongoing community transmission in the lower mainland, but we are fortunate enough up in the Whistler area and in the corridor in general that we don't have that ongoing community transmission as much. So cases tend to come through more sporadically. Mm. And I'm sure many of you were affected more recently. Now in the second wave, we did see quite a number of cases come through Whistler. Initially in the first wave, I will say the majority of the cases were visitors. And most of those visitors were doing what they should do, which was keep to themselves. And so we didn't see a lot of secondary transmission in the community. The difference now in the second wave is that we have seen cases going through the social networks within Whistler. And so that was where we're actually seeing it in residence. And so I know that impacted a number of businesses up there. And I really appreciate that we did have our environmental health officers go out and reach out to a lot of you. And I want to applaud everyone out there too, because we had nothing but very positive feedback for the COVID-19 safety plans that are already in place. I think people are really making the effort not only to protect their businesses, but also the local community as well too. And it shows because those cases that we did have, they were social transmissions. And I can say for all of them, we're pretty confident for all of them that the transmissions did occur in social contexts and not within the businesses themselves. And we didn't see any transmissions to patrons as well too, which I think is very important. And I really want that feedback to go back to the businesses that what you're doing works. And I think we need to keep it up. And these are the things that are going to allow us to keep our businesses open and keep the community safe. So, I mean, the main purpose of today, and I think we'll answer a lot of it through the questions, was really just to give people a bit more of an insight. Public health is a bit of a black box for people. And for my role, just to outline it, so I'm the medical health officer. There's a number of us within Vancouver Coastal Health Authority. And my job as the medical director of communicable disease control is to prevent the ongoing transmission of reportable diseases, COVID-19 being the newest of them. So, you know, I'm in the unfortunate position during a pandemic that that's my responsibility, but that's basically what our team does. So the people that I work with are all the contact tracers. So those are the folks that are reaching out by phone to all the cases, and then to anyone to whom those cases have been in contact with, and then to yourselves as well, if it does impact your businesses. So I'm happy to talk to the process today.
That's great. Well, I really appreciate you being here, and we certainly have some questions for you. These questions, as I said, have come from several business owners that have some questions, and also from some of the medical staff at the Whistler Medical Center that have been fielding a lot of these folks that are coming through with some inconsistent needs coming from employers. So we really want to just make sure that we give them the right message and provide them with the right tools and resources moving forward. So that being said, I guess the first thing on a lot of people's mind is our business community's primary concern is how to keep businesses open when so much of our workforce lives in high density shared accommodation. So for example, we've got some homes that might have 8 to 10 people living in it. With 8 or 10 different employers. That's a lot of crossover. So what's the protocol there if someone tests positive, a roommate tests positive, or an employee has been contacted? Like it just can roll out of control. So what can you tell us is the best protocols that we could be communicating with businesses, but also them connecting with their employees?
Yes, the way the process works is when someone tests positive, that positive lab not only goes back to the testing doctor, the copy of it also comes to me, comes across my desk. Right. And so the first step is for us to reach out to that individual who's tested positive, let them know that they are positive. And then we engage in the contact tracing process, whereby we ask them all the information, not just where they work, but where they've been, where they live. And as many of you know, some of those cases were among folks who are in high density housing. A lot of our staff who work in the village largely, and they are in large houses. I think the largest that we dealt with was 14 individuals living in a single house. Wow. The concern there is the majority of the transmission that we're seeing in BC, approximately 70% happens in the household. And so people who are roommates or other household members, we ask them all to self-isolate if there is a case in that household. Right. And so I appreciate that disproportionately impacts a lot of the businesses because in a household with 14 folks and one positive case, you then have 14 people who are out of work for 2 weeks, and that has quite the impact, not only in the businesses, but also a financial impact and burden on those folks living in the home too. So, so it's a real challenge, but there's good reason behind it because the chances of those roommates becoming positive is very high, and anyone else with whom they've had fairly close contact. And so that's why we are asking those folks to isolate for the duration of the incubation period. Right.
And that's the 14 days. So even though they may not have tested positive for COVID, they should still isolate because they've been in contact with.
Exactly. Okay. Yeah. And so, I mean, if someone is not a close contact, if it's somebody you saw and it wasn't within the infectious period of the case, then those people aren't at risk. And so that's basically our job, is to figure out who are those folks who are at risk, and those people who live in the household are going to be the highest. Right. People in the workplace can also be at risk, but we're not seeing those transmissions as much because the businesses are following good COVID-19 safety protocols. Right.
So having people over to those homes as friends is not a good idea right now. Eliminate and reduce that substantially.
Yeah, you know, and that's never a popular decision, especially this time of year. But you know, that's what Dr. Bonnie Henry put forward as the provincial health officer, and she's right. It's based on a lot of the epidemiology and the communications that we've had with her, and that's where we're seeing those transmissions is in private households and social settings. Right. And that's why we're asking people to reduce that as much as possible at this time to prevent that spread in their communities.
No, that makes a lot of sense. And in tying into that too, there's a question that was asked was, when can an employee that tested positive come back to work when he or she is not contagious so that the workplace is safe?
Yeah, so that's a common question. When people test positive, we know they're typically infectious up to about 10 days after their symptoms first became apparent. So, you know, at the time that they test positive, they're already usually a couple of days into their symptoms, because that's why they typically go for testing. So we do get a hold of them, and once we do have that history and we know approximately when those symptoms started, we will call them pretty much daily until we get to a point that we would clear them. That's typically after the 10th day. However, some people do get sicker, and those people that are sicker, we follow along longer, and then we do clear them eventually. But I would say, by and large, the vast majority, especially among younger population, which is the population in whom we've seen infections in Whistler, are being cleared. So they're free on that 11th day to go back. We know they're no longer infectious at that point. They pose no longer a risk to anyone else.
Wow. So you're connecting with them on a regular basis.
Yes.
That's impressive. Okay, that's great. One of the questions, I believe this one came actually from the Whistler clinic, the medical clinic, was people, and they're getting a lot of requests for medical notes that may not be necessary. So the question goes, people who have tested positive are saying their employer is asking for a negative test result and a doctor's note before they can go back to work. What should employers be asking and expecting from their employees? And certainly wanting to lessen the burden that we're placing on our healthcare workers. What would your suggestion be there?
Absolutely, yeah, it's a common question. And this is where I think it's important to know that public health is here and that we are actively in this process of monitoring cases and making sure that they are clear and safe to go back into the community, including work. So I do often hear stories of employers who are trying to be good community partners, and I applaud them for it,
Right.
and that they want to ensure that, that people aren't coming back to work too soon. So I just want to reassure them that public health is there and checking in on a daily basis with those positive cases and not sending them back to work until we can clear them. So I would say it's not necessary to request notes or negative tests or anything of that nature before people go back to work. The issue with that, and one of the reasons that we want to make sure we keep the clinic available, is that sending folks down to the Whistler Clinic to get notes or going to their family doctor takes up a fair bit of healthcare resources. I appreciate we want that reassurance, but at the same time, it's not necessary because my team is making sure that those people are certainly no longer infectious before we clear them to go back to work.
So there's clearing on your end. So once they're cleared to go, then that should be sufficient rather than going for that doctor's note. So that makes sense.
Yeah, I would add too, I mean, if they go to a walk-in clinic or see a doctor they've never seen before, that doctor won't have that background and the information to be able to clear them appropriately. So there's not much value in something like that, and it does take up resources. So I appreciate people looking for that reassurance, and this is what I'm trying to provide as well. So just letting folks know that the process is in place.
That's great. And still along the same lines of that self-isolation and negative testing. So one of the other questions from that we're getting quite a bit is people who have been exposed to COVID ask why they still have to self-isolate for the full 14 days, even though they may have received a negative test result. So
there's always a challenge, people tend to, hang their hat on the testing as if it were the litmus test that tells you everything you need to know. However, the test is not a perfect tool, especially if you've been exposed. So the issue being that if I were to be exposed to COVID, I can go and get a test, but that test is only going to tell me if I'm already infectious and shedding virus. If I've been exposed to COVID, there's an incubation period. So I may develop symptoms anytime between 2 and 14 days after that exposure. And a test doesn't change that, unfortunately. So the problem with getting a test, especially early and without any symptoms, is that it's almost certainly going to be negative, and that's falsely reassuring because people could still develop disease up to that 14th day.
Right. Okay. That makes sense. Makes a lot more sense. With the holiday season obviously upon us right now, many want to visit their elderly parents and are asking the medical staff for tests to be reassured. Is that something they should be doing? Is that something that, again, putting more pressure on our medical teams? What are your thoughts on that?
Yeah, and again, this is where I wish that that's what the test would do for us, is to give us that reassurance that we're clear and safe to go and visit our relatives. But I think people need to be aware, if they were to get a test, especially when they don't have any symptoms, it's not going to give them any useful information. It's certainly going to be negative almost all of the time. But again, it's the whole matter of the incubation period. There is COVID circulating, and if you've been exposed, you could develop those symptoms of COVID. Whether or not you have a negative test. That's why we say don't seek a test until you have symptoms. The other concern with COVID is much like the flu in that you actually become infectious to other people before you develop symptoms, about 48 hours before. So once you develop symptoms, you've already been possibly exposing people for those 48 hours before, which again speaks to why it's important to make sure that you isolate. But again, also why that test doesn't leave you free and clear. Why you do need people to isolate for that entire time. And so if you're going to be visiting friends and relatives, grandmothers, grandfathers, we want to make sure we don't put them at risk. And I'm afraid the test doesn't help us in the way we wish it would,
Right.
in clearing us to go visit them, that we don't have any COVID in us.
Right. Makes sense. Yeah, it's unfortunate. It's a tough time for everybody, for sure, no doubt. My mother lives in North Vancouver, and I've seen her twice since February. So she's older and she's got Parkinson's. So I'm we do Zoom meetings. Like
And
this.
thank
That's
goodness
what
for
we do.
Zoom. I can't imagine the
Thank goodness
pandemic
for
without it.
Zoom. Yeah, no, I agree. I do have a couple more questions. How can we get a better process in place for testing of staff being held out of service due to potential exposure, to avoid dozens of people being out of service for 10 days, 2 weeks? I mean, we're seeing this rolling closure of businesses. So I know that you've been asked this question, and it's so heart-wrenching for us to see this rolling closure. Not everybody can survive more than one of those. And so, what more could we be doing to avoid that?
Yeah, it's a good question. I mean, it's kind of the lesser of two evils. I think if I had to put it in any way, what we saw happening with the cases that were in Whistler over the last couple of weeks, we did have to isolate a lot of people. And that's unfortunate. It has quite the impact, but at the same time, we're seeing that it's working and that
Right.
the cases have gone down. I have not seen any new cases in Whistler for the past week, which is fantastic.
That's great.
Yeah,
Okay.
it's basically a short-term pain for the long-term gain, because if we weren't to isolate those folks and we were to send them back to work too early within those 2 weeks, then you see the ongoing transmissions when people are, again, outside of their households.
Okay.
And you don't want to put others at risk. So I appreciate there is that short-term pain, but at the same time, we have to keep on top of this with contact tracing to keep the levels as low as possible or eliminated. Because if we don't and those levels go up, then we risk that greater closure that we've seen before in the first wave.
Makes sense. Yeah, it's really tough. It's tough to see the businesses go through what they're, well, everybody for that matter, but watching businesses that have been there for a long time, feeding families and things. So our heart goes out to everybody right now. I know that there's obviously the big word on the street, of course, is the vaccine that's coming through. So as the vaccine is delivered across the country, at what point are businesses likely to be given the PHO approval to be able to relax their COVID-19 protocols in place? And I mean, we've got so many restaurants and such that are, reduced their capacity tremendously, that are really suffering through that. So do you know what that rollout might look like?
Yeah, I mean, that's the million-dollar question. Bonnie herself was asked this question this morning on CBC, if anyone was listening.
Yes.
And, we don't have a quick answer for that one. The answer really is as soon as possible. I can tell you, the vaccine, our first shipments are arriving within the next week, and we have to prioritize those populations who are the highest risk. So we're working on long-term care. The goal is to, limit the number of deaths that have been happening. And then we are going to be vaccinating people the day after that vaccine arrives. But we do have to follow the highest risk populations and work our way down. I'm hopeful that we're going to get to a level of 60 or 70% of the population immunized by next summer. But we will see. It really depends on the volume of vaccine and the supply. But I can tell you, we are going to use all of our resources, and I'm actually right next door to the vaccine planning team, so I can I'm over there right now.
We're going to get you back and talk to us for sure in the next few weeks, no doubt.
Yeah.
I think
so, it's a challenge, but we do have a lot of vaccine coming down the pipelines between Moderna and Pfizer, and there may be more in future as well too. But the sooner we're able to do that, it'll ultimately be up to Dr. Henry and the ministry when they start to relax those orders. Yeah. But I'm very hopeful that next summer is going to be much closer to normal than this summer was.
Oh, that's good. That's really good news. I really love to end something on good news right now. But before we do close off for the day, one of the interesting posters I think that's come through Vancouver Coastal Health is, and I've seen it, it's about Jersey cream, but it's basically if you're near your self-isolation, you're not supposed to be skiing. I know it's a no-brainer, but it is something that I'm hoping it doesn't happen, but there is a poster there that we will be sharing those tools and resources with our businesses through an e-news that we'll send this video out on as well. But any comments on that, or any final comments on your end?
No, I think, we're never going to get 100% compliance with people. And I think it's important to know that this is supposed to be population level interventions. And I can tell you the majority of people and the majority of businesses out there are doing the right thing most of the time, as much as they possibly can, and it works. And then public health is here to chase around the cases that do occur as a result, and to make sure we try to keep everybody as safe as possible and try to get things back to normal as soon as possible. So again, I just want to thank everybody, because I really appreciate what a strain this is, and what a challenging time it's been for everyone. And that we are making every effort we can to get us back to normal as quickly as possible. We appreciate all the efforts of the community to help us get us there too.
Well, I would have to say the same for Vancouver Coastal Health and the teams that you have and the work that you're doing. I can only imagine the pressure you must be under, and hopefully you're taking care of yourself as well. So I have from your team received additional tools and resources that we will also share with our business community. And I would love to have you back and in the next few weeks, just to see where we've landed, and keep this conversation flowing as we get more and more questions that might pop up in the near future. So really appreciate your time, and I hope you have an enjoyable holiday. And then when you're back up here, we hope to take you skiing on our lovely mountain and share a gondola.
One day.
One day. So thank you so much, John, for being here, and we'll definitely stay in touch.
That's good. Thanks, Melissa.
Thank you.